We're now going to work through the back, and then I'm going to turn my client over to work through the chest and neck and arms. And we're going to do that both prone, face down, and then supine, face up. So a couple of things before we start and a couple of considerations. When we're in this position, pillow under the feet. If someone has quite a lordotic lower back or quite a lot of lower back pain, then sometimes putting a pillow under their tummy is a really nice way to soften the curve through that lower back and make it a much more pleasurable experience for them. Another thing to note is if your client is quite rounded or if they are quite large chested, then sometimes this position allows their shoulders to really rotate round onto the bed. And if we're spending a lot of time focusing on opening that chest up, getting some more extension through that spine, then we don't want them to sit in that rounded shoulder position for 30-40 minutes. So sometimes it can be really nice to have your little towels and put them under the shoulder. So there's not too much of a difference here, so that's thick enough for this client, but you can always double it up, quadruple it up to make it thicker if you need more of a lift on those shoulders. So simply ask your client to lift the shoulder, slide it underneath, and place your shoulder back down. I said not always needed, but if it's uncomfortable for your client or going against your treatment approach, then you might want to add those touches. So next up, palpation. You'll be sick listening to me, same approach. We want to find out what's going on. How do the tissues move? And I'm just going to use compression and a little bit of movement to do that very same thing. So it's going to be therapeutic and feel really great, as well as being our biggest sales tool. So what I'm going to do is try and tease the tissue of those muscles along the spine away from the spine. So I'm not looking to compress tissue into bone or compress onto bone. This is simply about compressing the tissue away from that joint. And what I'm trying to establish is, how is that spine moving? How are the tissues moving along that spine? And expect it will be quite different from the lumbar through the thoracic, upper thoracic and into the neck. So it's important we palpate the whole of that spine and also into the hip. So I tend to use one hand to stabilize, one hand to palpate. So let me palpate how the pelvis is moving and that lower lumbar area. So I'm simply rocking back and forth and feeling how is it moving. Moving quite well through that lumbar area. And then I'm going to use my opposite hand, power from the back leg, to simply start compressing into those erector spinae muscles. What am I feeling? Is it hard, soft? It moves a lot less here, bingo, around that mid-thoracic area. And even if you don't know what you're looking for, what you should be able to feel is differences, where it feels different in one part of the spine to the other. And just working the whole way up that spine, a little bit of movement. And I'm doing both sides of the spine, because often people are different from side to side, so watch my back heel. I've connected with the tissue, I'm in a strong stance, and then I push into the front of that foot to get movement. Same story here, it starts to tighten up as we get to the thoracic, and when we hit that mid-thoracic area, the movement is quite restricted. Good, so we have some clues. Our client has had some clues. Doing a little bit of compression into those upper traps from side to side. Yeah, quite tight here in her left side. We've got some clues as to where we think we need to do some more specific work, but our client has felt that too. So we want to expose the back. So we're going to take the towel down. And this client's pants are quite low, so this is quite nice. I don't even need to tuck that towel. If someone was wearing quite high-waisted briefs, boxers, trousers, then you might want to ask them to roll it down. And you might even ask them to tuck it in to create that border. Because if it's something lycra, it's often going to roll back up, which is going to make the treatment less effective if you can't reach the whole of the back. Next thing is bras. So obviously men don't wear them, so that's straightforward. With some clients, they'll take them off, other clients will leave it on. I leave it completely up to that client, but we don't want to massage over it, so it's important that we open it. Always ask your client's permission before doing so. Do you mind if I open this? Excellent. You can also ask your client to take their arms out of the bra, but you must remember to put their arms back in and to close it before turning your client, as it can be quite uncomfortable if your client's lying on it and they're trying to turn, falls on the floor, becomes a trip hazard. So if you open the bra, you're in charge of closing the bra to ensure that there's no health or safety risk. So we're going to start with some effleurage. So we could do that bilaterally, both sides. I can translate my weight forward, so from the back of my squat to the front, but I instantly run out of space, so I have to bend at the hip to finish that stroke. So I might do 1 or 2 strokes in this position, but I'm immediately going to move to one side or the other because it's just not ergonomic for me as a therapist. Okay, so just using some assisted hand here, nice soft circle with the arms, slowly lifting that back heel and coming through the tissue at the top. And don't forget the back of the shoulder blade, so into those rotator cuffs. Okay, I'm going to show you that on both sides. You can see my form as well as what my hands are doing. So watch that back heel, it's lifting, I'm travelling forward, shuffling so that I have enough space. And when I get to the top, simply rotating and onto my forearm as I come through the upper traps. And through the back of that shoulder blade. So this is just a pressure down through a hand. Now I'm just going to change my applicator to a soft fist. Lifting that back heel, travelling forward. And coming through the back of the pelvis. I will often just use forearm once I get through those first few strokes on the back. Quite a broad applicator, but it's quite a broad part of the body. So nice relaxed hand, lifting that back heel, shuffling to move forward, rotating my arm to come up between the spine and the scapula, and then simply rotating to come through the traps at the top. Lovely. If I wanted to work more specifically into those erector muscles, then I would come up onto a soft elbow. Notice that nice swan-like hand, no tension, and I'm simply going to lift that back heel as I slowly move through that tissue along the spine. Nice and slow, and then just coming up through the trapezius. Lovely. Remember, effleurage doesn't just have to be longitudinal. We can absolutely apply effleurage transverse, which is lovely. So an assisted thumb through here, passive hand, passive thumb, pressure comes through the hand on top. And I have 2 options here. I can either get into a lunge and simply lift my back heel as I work through that maybe inch of tissue, 2 inches of tissue in someone quite large, and just shuffle my way up along the spine. Or I can be in a squat and simply transfer my weight from the back of my foot to the front of my foot. So play around with it and see what feels comfortable for you. So we can do some deep strokes with effleurage. So effleurage can be very deep. So for example, through that lumbar area into the quadratus lumborum, my hands are coming between the pelvis and the ribs, and I'm simply sitting back, weight into the back of my squat as I do some nice slow deep strokes through that QL area. So lovely for people with that lower back shortness or tightness. But this could be anywhere, look onto the back of the hip into glute tissue. Same principle, I'm just working across the fibers, sitting back into my squat. Okay, again, I can now be transverse. What's key here is hips are always square to your direction of travel. So here I'm just working through that upper trap and then just sitting back Doing some nice long deep strokes through that anterior, so the front of that trap as well. Sitting back into the tissue. Effleurage. Now, petrissage. So we can do some ringing. Ringing is really, really nice through the upper traps. They're quite a meaty muscle. There's also quite a lot of space. There's no resistance in front. So it's really nice to be able to just pick up that tissue and create that ringing pump effect. As we come through the back of the scapula, into the rhomboids, into the lumbar area, I find that kneading can be a little bit more effective, so that figure of 8, side to side. It's more superficial through here. This one works so well. So just picking up that tissue with the hands, creating a pump. It's not an effleurage. I hope you can see that in the video. See how much tissue is being picked up between my hands. It's a ringing, a squeezing, a pump of tissue. And then ringing works lovely through the lower back. Cross the glutes, the back of the pelvis, into that quadratus lumborum, just picking up that tissue, moving from side to side, weight from foot to foot, in a squat position. And then coming back to effleurage. So effleurage is a lovely connecting stroke, a lovely finishing stroke. Helps you palpate what you've done. Help signal to the body and the client that you've finished with the deeper work in that area. And as I said before, don't forget the back of the scapula. So a nice passive hand, weight forward, or even onto a forearm. A nice technique if you want to engage the tissues, wake up your client, get some stimulation to an area, is to Palpation. So I'm just going to do a little bit of hacking, so avoiding the bony prominences, focusing on the soft tissue, creating a nice rhythmical motion with the hands. Fingers relax, so listen, it's a thud, so it's quite uncomfortable for the client when your fingers are tense. Whereas when your fingers are relaxed, hear the difference. It's a lovely, soft sound, and that softness translates through to your client. So keep your hips square to the direction of travel, and just working through that hacking. And remember, as in the intro video, speed makes a difference. If you're trying to stimulate an area, but you don't want to shock the tissue, surprise the tissue, awaken the tissue, then we might want to do some slow paced hacking. So very different feeling, different intention when the speed is slow compared to when that speed is fast. Prayer I find really nice on the bigger muscle groups. So here it is a simple rotation of the wrist. Again, relaxed fingers. Tense fingers, sounds hard, feels hard. Relaxed fingers, we get a nice, soft, loud sound and a softness that comes through to the tissue. Again, speed dictates intention here. Are we trying to waken up, engage, enliven, or are we trying to switch off, down train, relax? And cupping, as I said, really nice. Research shows helps to break down mucus in that thoracic area, in the lungs. So again, with all of these techniques, it's not slapping, it's not tension. It's relaxed, soft applicator, and nice, smooth, fluid motion. Compared to a slap, we're looking for a nice hollow popping sound. It can be used in other parts of the body, and again, speed can vary. So a nice way to finish your treatment if your client is sleepy but having to go back to work or get back to sport. Now, when you've finished your work on the back, Important that we also close the bra again. And before we turn our client, what is it important to do? Palpate. How does that feel? Does it move better? So even just with our general massage, some basic strokes, there's a real increase in movement through that thoracic area. You can even see by how much her back's wobbling as I add a little bit of movement through those compressions. So she's getting a signal which is, wow, I'm moving better, it feels better, it's maybe less sensitive. Again, creating that powerful, positive playback in the mind as to what we've done with our treatment. So now we're going to turn our client. Important to note that if you had any little towels under the shoulders or pillows under the tummy, you remove those first. Then also remove any supporting pillows and put them on a clean surface before continuing. So this time I'm going to turn my client just using the towel up approach. Okay, so I'm just going to lift the towel up, ensuring there's no windows or mirrors on the other side, and simply ask your client to rotate onto the back. Lovely. And then it's important to support your client once more. So a pillow for under the head. And a pillow under the knees. So what we don't want to see happening here, so Danielle knows what she's doing, is for clients to lift their legs straight up, especially if they've lower back problems. So we want to ensure they lift it properly. So often the first time I'll have a client, I'll simply guide their legs. So slide your legs back down. I will put one hand here and say, now, bring your knees up for me. So it's just encouraging them to keep the feet on the bed. We can then place a pillow under the knees and simply ask them to slide their legs back down. So it saves you having to lift a heavy pair of legs and also ensure that they're keeping their body safe and not undoing the good work we've done on their back already. So now we're going to work through the front of the upper body. So the arms, the chest, the anterior shoulder and the neck. So areas that are often ignored. I think a lot of people don't consider the chest in massage, and I think a lot of people don't have confidence with the neck. So even from this general massage, I want you to focus on getting comfortable with that neck, because if you feel confident and comfortable, so will your client. So a couple of things to note here is one, exposing the tissues. So whether you have a male or a female on the bed, you still cover and towel that client appropriately. You can't assume that a man is happy to have their chest exposed or to even for in terms of comfort and warmth. So even if someone takes all their clothes off and they're confident, you ensure you towel them appropriately. So I need to expose that tissue, so I will often fold it down and create a line with the armpit. So we're getting it as low as we can. Then I can simply ask my client to bring her arms out, and I can just ask her to place her arms on top. And now she's created a really clean border at the top of the chest where she's comfortable, and also tucked it in so that it won't move. So she's comfortable and I now have a clear area to work. If they've left their bra on, that can be quite in the way. So you can either shuffle it down to the side and work chest, anterior, shoulder separate to arm, taking it up when you work the arm, or simply ask them to take their arms out of the bra. So I'm going to ask Danielle to do that. So can you take your arm out, please? Thank you. And just help your client. There we go. Done. Now I don't need to worry about it and my client is comfortable. Next up is palpation. So again, I think because the muscles are more superficial, they're smaller here, people get a bit pokey in that area. So no poking. We want to be soft and subtle, but we want to palpate. So often just a passive hand on each shoulder in a good lunge position, and then I'm just trying to see how those shoulders move. So first of all, pushing them down the side of the bed. How do they move from one side to the other? Then coming from the front down towards the bed, how are they moving? So definitely starting to feel some tightness through those pectorals here on Danielle, and also into the upper trapezius, up into the neck. So definitely not as much movement as I would like in that area. If someone has arms that quite hyperextend and flop over the bed like that, I don't want to leave them in that position even if they're comfortable, because if they're hyperextended in the elbow, it's just not really good for joint stability. So I'll often say to clients who are quite hypermobile in those joints to simply place their hands on their tummy. So now they're relaxed, their elbows are flexed and protected. So effleurage. I'm going to start by applying the lotion and the stroke bilaterally, so both sides together. Lifting from my back leg, simply opening my arms, and I might rotate my hands and use the palm of my hands as well. Okay, I'm just going to come up into the back of the neck. So straight away, pillow's in my way. What do? I don't want to shortchange my client's neck, so I'm simply going to move the pillow. Could you lift your head for me for a moment, please, and back down. Now I've created space because her skull is on the pillow, leaving the cervical spine free for treatment. So now I can come through those tissues, lifting the back heel, and now I can sit back into my leg, bringing my hands through, coming right up into the back of the skull. Coming down, lift the heel, now sitting back into that leg, and coming right up into the back of the head. So now I'm going to change to come from side to side, so working through the pectorals here, so I'm just using assisted fingers, and I can work right across the whole front of the body from this position. Still in that lunge position, heels lifting at the back. If someone's quite small, like Danielle here, I'm really just assisting with 2 or 3 fingers through that area. If someone's bigger, palm of hand can work quite nicely through there, or even a nice soft fist. What you want to avoid is in this area where the pec meets the shoulder, there's quite a lot of nerves, it's quite a rich highway of nerves and vascular activity. You don't want to create any pressure down and into that gap. So as we did with the back of the knee, we want to keep our pressure in the soft tissue, no pressure over that gap, and then we can reconnect that pressure when we get onto the deltoids and the anterior shoulder. And just changing direction, working through all those fibers of the pecs. Okay, we can then work down into the arm. I'm going to show you this from both sides. So one here so you can see my spine position, and then from the other side we can see what I'm doing with the tissue. So again, just general effleurage strokes, nothing changes there. Using a nice soft circle with the arms, and as I come up into the upper traps, sitting back into the back leg to get some nice deep strokes through the upper traps. And now I'm just doing some transverse strokes, palm of hand pressing down towards the bed. So just working across the bicep tissue. And down into the forearm. So assisted thumb, lovely through the forearm too. Just keep that thumb nice, passive and relaxed, and shuffle forward when you want to come up through the full length of the arm. Petrossage, lovely through those forearms as well. Just watching my hips, watching my posture from side to side. Through the forearms, shuffling up and through to the bicep. So nice soft hands, coming up, use one hand to stabilize, and up into that anterior shoulder. Hand is relaxed, assisted fingers, and then coming back through the upper trap, sitting back into the leg, just bringing that tissue through a deep effleurage stroke. Different applicators, so a nice open soft fist, nice and slow, shuffling, keeping the depth the same. And then as we come up and into the shoulder, getting some nice traction and a nice deep stroke through the upper traps. Now, using one hand to stabilize, the other hand, I'm pushing, lifting my back heel, pushing my hand down towards the bed. So nice transverse effleurage strokes. Through the bicep and even round into the tricep. Assisted thumb work, passive relaxed hand, pressures from the back leg as we move up through those wrist extensors. Remember changing the direction, different fibers, different muscles. And not to forget small area, but petrissage, so effective through this area. And they're counter forces, one pushes, one pulls as you twist through your hips. Right. So doing a little bit more specific work on the neck, note my position here, a squat. We're going to be working from side to side, and a squat allows you a really good, stable position to do that. In terms of forwards and backwards, we're only going to be moving in a 2 to 3 inch space. So the squat moving from front of foot to back of foot gives you enough movement, but our movement is more side to side. Okay, so I want you to get confident with the head and neck. So taking one hand to support the head and the neck, and the pillow still there, our other hand is free to work through that tissue. So here I'm transferring my weight to my right side and then transferring it back to the left. So allowing me to come right up into that skull because I've rotated the head, and then to easily swap hands, and transfer the weight to the other side. So allowing me to get right in to those extensors of the neck. And again, coming through the front of the shoulder, transfer weight to the left and right up into that suboccipital area. Even just doing a little bit of pinching with the hand at the back of the neck is a nice way to palpate those tissues and see what's going on. Finishing the whole of the stroke at the base of the skull. And then working bilaterally, both hands coming back, sitting back into your squat and bringing that tissue right to the base of the skull. So some really simple effleurage for the neck that will feel great for your client and help you get confident working in that area.